Hi, today we are going to continue with our rash series and talk about two very common viral rashes. And we're going to talk about fifth disease and roseola. So first, fifth disease, which is also known as slap cheek disease, also known as erythema infectiosum, is caused by a virus called parvovirus B19. It's spread by respiratory particles, and its incubation period can be up to 2 weeks. Its clinical presentations usually include like a fever, a little bit of congestion, and the onset of rash usually starts off with really red cheeks, and then you'll start seeing some lacy, fine rash all over the body. Typically the rash will go away within 10 days, but it's also known to come and go for several weeks. The overall presentation is usually very mild, and so treatment is only supportive care. There is one common complication, and that is long-term anemia, because the virus can suppress the bone marrow. And one additional thing is when a child does have fifth disease, we would like them to stay away from any women who may be pregnant, as if they are to catch this virus and pass it to the fetus through the bloodstream, it can cause some abnormalities. Now, the second virus we're going to talk about is roseola, and that is also known as sixth disease, and it's caused by herpes viruses 6 and 7, and its incubation period is about 5 to 15 days and is also spread by respiratory particles. Now, the presentation of this virus is very classic, in which you're gonna see the child having very high fevers for 3 to 5 days, and we're talking about fevers of 102 or above. Sometimes they'll have a little bit of cold symptoms, but then all of a sudden the fever will abruptly stop, and within 24 hours you'll see a rash appear. Now, this rash is going to be this fine red rash all over the body, sometimes head to toe. Now, again, it is a mild virus and only supportive care is needed. One common complication of this is febrile seizures, and that's due to the fact that you get that abrupt high fever, sudden onset. The good news is there is no long-term consequences for it. It is just acutely they can have a seizure. Thank you for listening, and we are going to talk about more rashes next time.